Good evening, everybody. God, it's nice to see everybody's face. It's on. It's nice to see everybody's face for a change. It's been a long time. Uh, Hopefully next month we'll even get back and have donuts, hopefully. Um, Depends on what the rec centers lets us do, but there'll be some announcements coming the end of the month. First on our agendas, we're going to stand for the pledge to the flag and then stand for a moment of silence for our men and women and first responders. Thank you. Please be seated. By the way, for you that don't know, my name is Cliff Weiner. I'm president of the POA. Anybody who would like the job, please raise your hand. I'd like to give it to you. If you have a cell phone, please put it on vibrate or off so we're not disturbed. Next is, I believe our secretary's report. Oh, Reb, I'm sorry. Our secretary's report from our secretary, Reb Benson.
All right, thanks, Cliff. He always leaves me out. He's ready to go right to the treasurer and the treasurer report first, you know. Yeah, I know, isn't she? Anyhow, what we try and do is, since this is a general membership meeting, we go through the minutes from the last meeting that we have. And from that meeting, we then have you all hear what we had to say from that meeting. A lot of times is what I go over. You'll see in the POA bulletin, obviously, that was that month. But here I'd like to cover a few things. So the last general membership meeting we had was March 16th, right here in this room. And some of the highlights from it, we don't cover everything, is obviously we had our treasurer's report back then, which stated February income of $37,811, expenses of $14,846, with a net gain of $22,965 in February. We had a couple questions that came from the audience at that time. It says, do we know when District 12 will come under district control? We were told by 2021. Answer, it depends on a few factors, such as the number of homes sold and the length of time from that point, with a final date usually not known until it's about to happen. In reference to deed restrictions, there is no capability to modify those. That is a contract at sale between the buyer and the developer. Our speaker at that time was Mr. Ed Jimenez, the CEO for the University of Florida, Central Florida. And some of his comments he made was, he mentioned that he was from New Jersey and went to school in Boston and New York and came to Gainesville, Florida 11 years ago. That he will never tell you something he cannot deliver on. He needs our help in making health care better for all, but will not deal in hypothetical situations. He needs specifics when it comes to problems that need to be solved. So he started about 6 years ago as far as this merger or this partnership with the Villages Regional Hospital. First they focused on one item, and that was stroke patients. And the reason they started that relationship was they started to see more people from the Villages going up to Gainesville. So that's why they decided to work on that. They're now addressing protocols, and then they're going to go into education and training and facility care. The intent was that University of Florida would handle quality and the Villages Regional Hospital would handle administration. But it was clear that UF's role had to be bigger to ensure a high level of quality. They began searching this past October for a full-time chief medical officer with University of Florida pedigree, and then the Villages Regional Hospital CEO, Don Henderson, moved into a new role at that time. The biggest issue for emergency and hospital care is what they call queuing theory problem, which basically means available beds. They're trying to find moments to create more beds, such as decreased fragmented communication. There's no final decision on building a teaching hospital, but the plan would be to build a 200-bed facility just west of the Turnpike in the next Village area that can expand to over 600 beds. A couple of questions that were asked: is specialty medical services available to all? Answer, yes, only primary care is under Villages Health. Would more doctors in ER, an emergency room, help? Answer, yes, but not as well as more beds and better communication. Will new teaching hospital have residents or students? Answer, it would have residents in Leesburg, the village's regional hospital, and the new hospital, but it will be a 3-year process to move from students to residents associated with that. Will the same surgical process in Gainesville be followed here? Answer, yes. Over time, for those procedures that will be performed here. There'll still be some things that still will be done only in Gainesville. And that was basically most everything from that meeting.
Thanks, Rep. Can I get a motion to approve those minutes? Second? All in favor? Let me just say a few things about what Rep said before I call Don up. Number one, they have hired a new chief operating officer, and I forgot her name. I know her last name is long. She's a Florida girl. We'll see how she does. I would like to say that if you guys have any issues or had any issues with the emergency room, please send me an email. I would like to know about them, and believe me when I tell you, I will see to it if we can't get something solved for you. But complaining about it without letting anybody know gets nothing done. We have to try to rectify the problems. Thank you. Next is our treasurer's report from our pretty treasurer, Donna Kempa.
Thank you.
Don't tell Tony this.
I'm thinking you want something more from me. There's probably some job someplace that he can't find anybody to do. Okay, so for the month of April, we had $20,194 in revenues, and we had $20,249 in expenses. So we had a operating loss of $55. Just because it's been really sporadic, our meetings, I'll give you the year-to-date as of April 30th, just to kind of catch up a little bit. So revenues, we have $85,519. And against expenses of $68,362. So for the year to date, we do have an operating surplus of $17,156. And our operating fund total is $148,284. Thank you.
Thanks, Donna. For those of you that were there in April, we had our shredding event, probably the most successful one that we've ever had. For those of you that helped volunteer and help us, thank you. I will tell you that we do have a date for our next one already. It will be, where's Sal? April 9th at the same place. There'll be more information coming. I've just put it on your calendar. We're going to give you plenty of notice this year, so we're going to start putting in the bulletin 5 or 6 months before. We only had 3 trucks this year. We can go 4, we can go 5. We have enough room to do as many as we really need if we have people to fill them. So it's something that's going to happen again. And we did have 31,500 pounds of paper that we shredded for people. Next is, we have 2 guests here, 2 Lake County, our Lady Lake commissioners, Jim Ritz and Paul Hanna. Paul and I served on the ARC together for many years, and Jim and I have a different kind of working relationship, but he wants to say something about some of the issues that are happening at Spanish Springs. Paul, you might want to leave, or you can stay. Sunshine Laws, guys.
Yeah. My name is Jim Reitz. I am resident in Country Club Hills for 15 years, coming up in July, and I've seen some changes. I'm pretty sure everybody else here that has been here for any length of time has seen changes in the Spanish Springs and also throughout the villages. Unfortunately, Paul and myself, we can only deal with what's in the town of Lady Lake, and Spanish Springs is in the town of Lady Lake, and we have ultimately the 5 members of the commission have the voice of what can happen there. There is a survey on the POA website called Spanish Springs Apartment Conversion, and I'd like everybody to go there and actually take that survey because we need ammo to try to keep the villages, the part that's in Lady Lake at least, the same without changing, and because it's not the lifestyle that it was suggested to us when we bought here. So we don't want to have any more changes. I will put my my contact information on the POA website if people want to get in contact me directly. Anything else?
No, whatever you want to say. It's your time.
That's good. That's all I want. I need support.
Thanks, Jeff. You guys hear me say this, and we've been saying it now for about a year at every meeting. This is called the Vial of Life, put up by the Sumter County Sheriff's Department. It's probably the most important thing that you can do. I've had personal experience with this when my wife had a medical emergency, so I know what it does. We have these in the back. You take one of these forms that come with it. You fill it out, put it in that vial, put it on your refrigerator, put one of these green stickers on your front door and the other one on the front of your refrigerator. In the case of an emergency, seconds count. It's really, really important. And number one, when one of your loved ones is having a medical emergency, you sort of panic. I'm pretty calm, and I'm a CPR AED instructor, and I still panic when my wife had a medical emergency because it's my wife. So that makes a big difference, guys. I have made a promise that we will do this every meeting until every household in the villages has one of these. Got a long way to go, but we're getting there. And I talked to Lieutenant Seymour the other day, last week, Friday, and the Sheriff's Department has another program called the DREAM Program. If you're a caregiver for somebody with Alzheimer's, you might want to call Sheriff Seymour at the Sumter County Sheriff's Department. They have some really good tools to help you with people that are going through Alzheimer's and dementia. It's a brand new program. They got a grant to do this program, so it's something you might want to look into. I promised them I would keep talking about this until we get everybody's taken care of. I want to say in the back we got our friends from University of Florida Auxiliary. We got my friends from the Villages Shrine Club, which I happen to be a member of. If you want any information from them about that group, please feel free to see them. And we got my good friends from Seniors versus Crime. I tell this story at every meeting too. A couple of years ago, I got a phone call from a lady who wanted to know if I could help her. She was about 95 years old. She gave a contractor $73,000 up front to do a job, and he disappeared. It was really heartbreaking. She was devastated. Please, before you have anything done on your house, inside or outside, please call Seniors versus Crime and see if they have any complaints. Save yourself a lot of time and aggravation. They are more than willing to give you the information they have, and they have quite a big database. I used to be part of that group too many years ago. POA is always looking for volunteers, guys, like we had at our shredding event. If you feel you want to help us, volunteer, please feel free to call me, and I am sure, find something for you to do. Sal, you want to say anything about the AED presentation?
Yeah, unfortunately, you all heard that the AED went down, the AED program in the villages went down about 2 weeks. There's been some talk between Sumter County and Public Service, and also what we call the Ready Alert system. The AED system in the neighborhoods are now up and running. So we apologize for any interference or trouble that has caused, but it was all, you know, kind of software and so forth.
By the way, if you belong to any other social groups and you want the POA to do a talk about many different things, feel free to call me. That's starting now to loosen up too. I have gotten 2 phone calls in the last 3 days. I have one in August and one in October, I think. But more than happy to do it. I do quite a few of them every year, and they're a lot of fun, and you learn a lot of things. Next is our cash raffle. We give away 3 $30 prizes, and today we lost money. First number, 068840. Let me finish. By the way, if nobody claims the prize, it goes to the president. I'm just going to read the last four numbers. 747. 747. Damn, I don't get that one either. I never got one. I've been doing this 6 years. Never got one of these prizes. Somebody always claims it. 855. 855. Right there, Jar. Sal had something else he wanted to say.
One more thing about the AED program. Now, the POA is giving out presentations. The reason for this is we want to proliferate these neighborhood groups throughout the villages. Right now, there are 230 neighborhood groups, and we want to build that up as much as we can. So if you're interested in your neighborhood, it wants a presentation on how to start an AED neighborhood program, please see me after the meeting's over. Thank you.
Thanks, Sal. Okay, next is the open forum where we'll try to answer a question that you might have on any topic. If we don't have an answer, I'll try and find out an answer for you. Jerry will come around with a mic, or Jerry and Sal or somebody. Anybody got a question? Wow, oh yeah. Sit down, David. I can say that to him, he's a good friend.
Speaking to the mic. Yeah, go ahead.
And I need to see you after the meeting because I know who you are. You called me and you and I are playing phone tag.
Wow, that's a hell of a thing to get up to. My name is David Robbins. I'm a supervisor in District 12. I'm not here speaking for the supervisors in District 12, and I have a question. There is a move afoot to form a second PWAC, and I wonder if anyone here from the POA or anyone else in the audience has thoughts about that, and I'll leave it at that.
We have lots of thoughts, and we have 1, 2, 3, 4, I believe 4 board members, supervisors of different districts on my board. So we have lots of thoughts, and you and I will talk about that. And I apologize, but you and I just can't seem to get together. You call me, I'm not home. I call you, you're not home. But please see me before you leave tonight. Anybody? Go ahead, David.
My name is Dave Winmiller, and my question has to do with the impact fees. I know it's been discussed many times, but there's competing legislation, or I should say there is legislation at the state level now that would appear to supersede the Sumter County view on impact fees. And I'm wondering if any resolution has been determined as to how the state legislation is going to affect the county legislation.
Actually, the legislation was passed. It rolls back to January 1st as to what it was, so that the impact fee that the Sumter County Commissioners proposed is not going to happen, okay? But I hear through different sources that there are some cities, because it affects more than just the villages, guys. It affects everybody in the state of Florida, every town and city. So there is some talk about a couple of cities getting together and suing. We'll see where that goes, and I happen to know for a fact that Sumter County's looking into some other options too. So we will keep you advised. It will be in the bulletin. It's a big topic, along with what's happening tonight with Sumter County and the ambulance service. Yes, sir.
Yeah, I'm not the sharpest guy in the room, but it appears to be that the Daily Sun is conducting an organized hit campaign against the commissioners in Lake, as well as the 3 new commissioners in Sumter County. Am I correct in my assessment? And if so, what can we do to get the correct information out so they are not discredited every day?
Well, I will say to you, you are 100% right. Half of what they're putting in the paper about the 3 new Sumter County commissioners is not true. 2 months ago, we ran an article rebuffing everything that they have said, okay? Because I know it's not true. What can you do? The big thing you can do is you can read the POA bulletin every month. I guarantee you that there is not one word that's put in that bulletin that is not true, factual, and been verified. That's something that I insist on. So if it's in there, to the best of our knowledge, it's true. We're not going to give you bad information. We're not going to give you fluff. That's not what it's all about. And we will try to keep you opposed of all of these issues. Unfortunately, they're coming at us from all sides. I mean, I've been here a long time, and I can't remember this many big issues at one time. So we're trying to do the best we can. I have a small board. Anybody who wants to volunteer and be on the board and help me, that's fine. This is a volunteer job that I spend 50 or 60 hours a week doing, because I think it's important for the villages to be represented and for us not to get taken care of. I've been here 19 years, hopefully to be here another 19 years, and I want to see it the way it was when I moved here. So that's my goal. Any other questions? Okay, couple of real quick announcements before we get to our speaker. Hopefully, like I said, maybe next month we can have donuts and coffee, which would really be kind of interesting. Next month, we're at Everglades Rec Center. Our speaker will be Lynn Hathaway on lighting. If you're a POA member and you buy a raffle ticket, you are eligible to win a lightning protection system for your house again. This will be the 5th year in a row we have done this. It's a great deal, guys. And it's done by a reputable company that does a really good job. In July, Bradley Arnold and one of the Sumter County Commissioners will be here speaking about what's going on tonight and the new budget that comes out in July. It'll be right here in this room. Please, if you're coming, come early. We'll have the overflow room next door, but I have a funny feeling it's going to be like a couple of the times the hospital was here and we had to turn people away. So it's going to be really good. In August, we're going to have a gentleman named Patrick Carr, an attorney from Miami, who's going to tell us about some insurance changes that are going on right now in the state of Florida on your homeowner's insurance. It's pretty interesting. I had a long talk with them about a month ago. And then in September, we have a group called Caring Neighbors. I'm going to explain a new group, a new program that they set up to take care of elderly people and people that live alone. It's kind of interesting. We are an aging community. So those are some of the things that we got coming up. Now, it's with great pleasure that I get to introduce our speaker, Dr. Norman Anderson, who's a good friend, who does a great job and has been a speaker many times for the POA. Doctor, it's all yours.
Thank you ever so much. Cliff, if I had known that donuts were going to be served next month, I would have rescheduled because I love donuts. Okay, we'll see how this works bringing up the program. We've got to hook into the, and I might have to unplug it and do it again. Okay. Basically, this is what we have been facing recently. Everybody thinks they're right. Unfortunately, everybody does not have the same opinion. And so, over time, what we've gotten is this. Let's go back historically and look at what has taken place over a little bit greater than 100 years concerning the pandemic. And then I want to move into a supplement, and you know I've talked about supplements before, but this one has such a broad application. You will find that it applies not only to the COVID situation, but it applies to your health in general. And the reason it does is because the basis of aging is inflammation. And if we can control inflammation, you can control aging, which includes not only diseases like arthritis, liver disease, but it also controls your immune system, and I'll give you specific examples of that. The compound that we're going to focus on is alpha lipoic acid, and as I go through the presentation, ALA will become one of your most important supplements that you can take. I do not market it. It is not a prescription. It is across the counter. The only country in the world that I know of that it is a prescription is in Germany, and the reason it is because they treat so many children with autoimmune diseases that the doses have to be specified specifically. So let's go back to the pandemic of 1918. It was a respiratory infection. 500 million people contracted that virus. 10% of that entire population, 50 million people worldwide, died of that virus. In the United States alone, 675,000 perished. That virus began in the United States, and unfortunately, as our troops moved into Europe for the First World War, they also carried that virus with them. And a variant of that virus occurred, and it literally devastated Europe. There were 3 waves to that infection. The second wave, which was the most devastating, occurred in Europe. At that time, there were no vaccines, there were no antibiotics or antivirals, and the only thing they had was social distancing and masks. Now, you need to understand that antibiotics do not work on viruses. But what happens is, when a viral infection occurs, especially in the lungs, it creates so much congestion that it sets up a beautiful environment for a bacterial infection. So you could have an underlying viral infection with a superimposed bacterial infection on top of it. There was at that time, in 1918, an anti-mask society of San Francisco, and there were several thousand members in that. So the idea of being opposed to masks did not originate in this last year. It existed well over 100 years ago. Now the present situation with COVID-19. Most recently, there have been 164 million cases worldwide, almost 3.4 million deaths worldwide, and greater than 600,000 in the United States have died. It began in China and is spread to the US, South America, India, in fact, all over the world, now including Antarctica. The number of waves, we have no idea yet how many waves are going to happen because the variants are still occurring. We do have vaccines, antibiotics, antivirals, as well as social distancing and masks. Now, the question that comes up periodically is, can someone who has been vaccinated shed the virus as a result of the vaccination itself? And the answer is absolutely no. You cannot shed the virus as a result of being vaccinated. You can, however, even though you have been vaccinated, if you are exposed to a person who is infected, become a carrier of the virus. And the likelihood of transmitting the virus to someone else after being vaccinated is extremely low, but not impossible. Let me give you an analogy that might make some sense as to what I'm talking about. This is the inner workings of a watch. If you were to take the bridge band and one of the ratchet wheels, and you expect to be able to tell time from those two parts, you're going to be waiting a long time to be able to tell time. And the reason why is because it takes the entire watch to be able to tell time. The same way that for this virus, if you were to remove a protein out of that and expect to reproduce the entire virus, that's totally impossible. Maybe that's a little better. And so when you get a vaccine, especially for this virus, you are not getting the whole virus. You are getting a mere fragment of the virus, the same way that you would be getting a fragment of the watch. You can't reproduce something that isn't there. What you want to do with the vaccine is to stimulate enough antibody response that it recognizes the virus and it destroys it. But you don't want to create unacceptable side effects for the person getting the vaccine. And that's why all vaccines are tested with volunteers before they're being administered. The effectiveness of this vaccine is almost unbelievable. If they had reached 70 to 75% effectiveness, they would have been happy. The effectiveness is well over 95% from the medical studies that I have read so far. So what really kills? Is it the virus, or is it ourselves that kills us? And in reality, the virus doesn't kill us. It's our response to the virus that kills you. Let me give you an analogy that might make some sense. If we go back to Savannah, Georgia, around 1734, when the colony was being formed by Oglethorpe, it was a planned community, and it was on a harbor. At that time in history, there were pirates roaming the east coast of the United States. Now, if a pirate ship decides to enter the harbor of Savannah, it did not fly the Jolly Rogers flag coming in. It came in unannounced, and it set up its base of operation. And before we knew it, it infiltrated throughout the entire colony of Savannah, literally controlling the entire area. Now, if you want to get rid of the virus, being the pirates, and you fire on that area with your cannons, you would wind up destroying 80% of Savannah in order to get rid of the pirates. What would have made sense would have been to have recognized the pirates when they were still out at sea and destroy them before they ever took a foothold into the harbor. This is what happens to the virus, and the reason why people our age are more susceptible to dying is because as we mature, I won't say age, as we mature, our immune system becomes less efficient. When you're in your 20s and you're exposed to a microbial infection, you will mount a good immune response rapidly. That's comparative to taking care of the pirates before they get a foothold in the harbor. But as we mature, there is a delay factor built in as to how quickly your immune system responds. And so if it takes 2, 3, or 4 days to kick in, and these bacteria, fungus, and virus multiply every hour and a half, you can imagine the burden of disease that you're going to have once that discovery is made. And that virus will literally overwhelm your body. What is also unique to this particular virus is your immune system doesn't stop by destroying the virus. What happens is your immune system fails to recognize what is you, and it starts to consider your normal cells as if they were the same thing as the virus, and it destroys the normal cells in your body. And that's called a cytokine storm. It means there is no hold back. It will control and destroy anything that it feels is foreign to your body. And so for this virus, it means lung tissue is destroyed. And that is not a temporary loss of lung function. It is permanent. Those lung cells are dead forever. In the GI tract, it's exactly the same thing. The gastrointestinal tract can be damaged by this virus. Your heart, your brain. And so what would be good is if we had some supplement that could aid us in dealing with this situation. What you really want to do, again, is get the Jolly Rogers when they're still out at sea and blow them away. Now, what I want you to do is to not accept anything that I say as truth. I want you to do your own research, because when you do, the favorite expression is going to be, oh my gosh. You are going to find out that this supplement does so much for so many diseases, but if you think back that the real cause of aging is inflammation, you will find that this supplement actually helps control inflammation. So go on the website to pubmed.gov and punch in alpha lipoic acid. You will find almost 5,500 articles will come up, 95% of which will be very favorable as far as the effect of ALA on a number of diseases. So that's why you don't have to believe me. Those articles have been compiled over 40 years. You can tell how exciting my life is when I'll tell you that I've actually taken the time to read all 5,500 articles, and certainly not done in 1 year. So alpha-lipoic is the strongest antioxidant that we know of. Let me give you an analogy that would hopefully make some sense, and if I say something that doesn't make sense, stop me, because my family has no problem stopping me constantly when I'm talking. Let's suppose you have a car engine. In order to produce power in the car engine, you have to use a fuel source. When you burn fuel in a car engine, you're going to get waste products. Otherwise, you don't get power. And as a result of generating those waste products, they need to be neutralized. And we do that in most cases with a catalytic converter. Every cell in your body is like a car engine. It will produce energy as a result of burning the calories, but in the process, it will also produce waste products, and they have to be neutralized. If not, they will build up and contaminate each cell, and that's called inflammation or aging. What you do to offset that is to neutralize these radicals, which are the waste products, and that takes antioxidants, and that brings up alpha-lipoic acid as being the strongest one. Now let's focus on infections. L-glutathione is a very small protein. It's actually called a tripeptide. It's not even big enough to be a protein. I guess it would be kind of like my size compared to a 6-foot male. But the bottom line is, it produces a protein called L-glutathione. L-glutathione is produced by your liver, and it controls your entire immune system. As we mature, the productivity of L-glutathione goes down, and as a result, we become more susceptible to viruses, bacteria, and fungus. And that's why senior citizens die regularly from superinfections. By the time they're discovered, it's too late. It doesn't matter how much medication you get, you'll be overwhelmed with the infection. You want to recognize the infection when it's still out to sea. And that's exactly what L-glutathione does. Taking alpha-lipoic acid regenerates a new liver. Not only does it build up the supply of L-glutathione, so you now have a functioning immune system, but I have actually regenerated new livers on patients whose livers have failed, either due to viral hepatitis, alcoholic cirrhosis, you name it, alpha-lipoic acid will help to regenerate a new liver. So what are the benefits of alpha-lipoic? First and foremost, it reduces inflammation. It increases the production of L-glutathione. And that becomes very important for COVID because as I was talking with a resident couple earlier before this meeting, I indicated that a good friend of mine is an FBI agent in Brunswick, Georgia. This gent is 280 pounds. He is solid muscle. There is not 1 ounce of fat on his body. The FBI uses him to knock down walls, not doors. He texted me in March, April of last year and indicated that he was bedridden, He was so weak he could not get his head off the pillow, and they were going to admit him straight into the ICU unit of the hospital and put him on a ventilator because he literally could not breathe. I texted him back to get alpha lipoic acid. His brother is also an FBI agent. They live close to one another. The brother went out, got it for both of them. They both started taking it. Within 48 hours, he texts me back, "I'm already up and moving around." 1 week later, the FBI retested him to see what the status was on the virus, and he tested negative. They didn't believe it. They waited another week, and they tested him again, and he again tested negative. Now, the most dramatic case that I have from my patients is another gent that I treated and cured for a head and neck cancer, a very advanced one, who in about May of last year, I gave him a bottle of alpha lipoic, and we give it out free of charge because I'm such a nice guy. And of course, rather than taking it, he put it in his medicine cabinet and forgot all about it until he came down with symptoms of COVID at the same time that his wife came down with symptoms of COVID, at the same time that their 2 children came down with symptoms of COVID. And that's when they all started taking the alpha lipoic. Within 48 hours, all of the symptoms started to effervesce. 2 weeks later, they were retested, and they all tested negative. I have 130 employees in my practice. All of them have been on alpha lipoic. We have had no problems with the COVID virus. Now, I'm not telling you that it's curative. I am telling you that it will motivate your immune system so that I am convinced many of my staff have been exposed because I have lost 7 patients to the COVID virus, and it wasn't due to the cancers I was treating them for. It was due to the virus themselves. It opposes insulin resistance, and that's important for diabetics because their insulin levels go all over the page, and by the nature of being a diabetic, you have an increased inflammatory response in your body. I have actually treated patients with alpha lipoic acid, and they have had to go off their diabetic medication because they are no longer diabetic when they're taking alpha lipoic acid. As a result, it slows the progression of aging. The laundry that I used to dry clean my trousers, that gent was so incapacitated with arthritis, he couldn't hold a pen in his hand. And when I recognized that and started him on alpha lipoic within a month, and I went in, he was wiggling his fingers like a 5-year-old and said, "No more symptoms, completely resolved." It improves lung function, so for patients with asthma, it can make a tremendous difference in breathing capacity. It reduces blood lipid levels, so if we want to get fats under control, and fats are actually healthy, even though the medical system has told you they're not, that's garbage, they are healthy, but they need to be controlled in their amount, and alpha lipoic helps that, and as a result of helping that, it helps to reduce weight for those that need to reduce weight. It has no effect on those whose weights are normal. Medical studies, and you'll see that when you go online, have shown that it destroys human colon cancer cells. Not all cases, but it aids. Reduces oral fibrosis. What that means is that over time, scar tissue can build up in the mouth in some patients, and the alpha lipoic acid will help to dissolve that away. Many patients over time, their mouths don't open as wide as they should. They get narrower and narrower, and it's due to scar tissue that contracts the muscles. It reduces hair loss in breast cancer patients who are receiving chemotherapy. It reduces neuropathic pain. There are some patients who are so incapacitated in their legs because of especially diabetic neuropathy, they can't walk across a room without feeling excruciating pain. By taking alpha lipoic acid in the majority of those patients, it eliminates the pain. It promotes bone growth in spite of steroid use. When you're required to take steroids, prednisone or decadron, that will cause an absorption of calcium from your bones. You would like to stop that, and the reason you would is because the less calcium you have in your bones, the less strength the bone will support until finally it could fracture. And so in order to avoid that, taking alpha lipoic would prevent that. It inhibits HIV replication. And again, that would make sense. This is a virus, and it helps to mobilize, ALA helps to mobilize your immune response, and that aids. It assists in wound healing. I have found that patients that are on ALA, if they do have an injury, they'll heal up much more rapidly if they're on ALA. Again, I've already mentioned arthritis. It sensitizes lung cancer cells to the benefit of chemotherapy, destroys other types of cancers, promotes the healing of the liver, and it will actually regenerate a new liver. Let me tell you a story about that. I don't know why dogs are attracted to my wife, especially when they've been abandoned and she finds them on the street. And it doesn't matter whether she's in Florida, if she's driving through Georgia and finds an abandoned dog, I wind up taking care of it the next day. The bottom line is, there was this beautiful, beautiful collie that Margaret had picked up, and it was limping when she picked it up. And when I examined it, there was a mass in the right thigh. I was very suspicious this was a malignancy. We took him to the University of Florida's vet school, and they diagnosed that it was, in fact, a malignancy. And they were going to start him on chemotherapy, and when they did, the chemotherapy literally wiped out the liver functions, and that's not unusual. His liver enzymes just went off the page, and they said there's no more treatment that can be given. The dog can't tolerate the treatment. So I talked to them about alpha-lipoic acid. They knew absolutely nothing about it, but because they knew nothing, they weren't willing to accept what I said. So I gave them a choice. You either give the dog more chemo, and I will keep him on the alpha-lipoic, or we'll go somewhere else. So they agreed to try it, and sure enough, the liver function test stayed totally normal, no change whatsoever. They then doubled the dose of the chemotherapy to get a more effective response against the cancer, and again, there was absolutely no change in the liver function tests. And Shadow lived a few years longer before he died of an unrelated cause. It wasn't the cancer. That dog was amazing because it could leap through the air into the pond near where we live. His head would come up, big smile on his face. He'd paddle over to the shore, allow his coat to dry, and then he would repeat the cycle all over again. Just an amazing dog. Treats chronic prostatitis and chronic pelvic pain syndrome. I haven't faced this dilemma in my life yet, but I have treated enough patients who have this scenario, and their quality of life sucks. And so if there's anything we can do to make it better, and apparently alpha-lipoic acid is the agent that will do that. Now let's talk about the side effects of alpha-lipoic acid. It can give you gastrointestinal upset. It is an acid. I would want you to start taking it with food to minimize that. And the doses need to be spread out, not taken all at one time. The average daily dose for the most effect and the least symptoms would be 600 milligrams in divided doses. If you are on thyroid replacement hormone, you do have to monitor your functions, and the reason you do is because it works so effectively, it can actually neutralize the benefit of the thyroid replacement, so that has to be monitored. If you have an immune thyroid condition, one that's called Hashimoto's thyroiditis, you will actually treat that disease with alpha-lipoic acid because it stops the abnormal immune response. Now, there is another brand of alpha-lipoic that avoids the gastrointestinal irritation, and that is R-alpha-lipoic acid. It's 46% better absorbed than the regular alpha-lipoic, but it's about 3 to 4 times as much. Even the regular is dirt cheap, so our alpha-lipoic acid is not going to break you financially. And if you do have a history of having any GI upset, I would strongly recommend that you buy our alpha-lipoic acid. And I wish I had invested in this years ago, because I could have retired a bazillion years ago from the benefits of this. How about the seasonal flu? What are we expecting this year? We have no earthly idea, but you know what you'd like to do is to have an ace in your back pocket, and alpha-lipoic acid could potentially be that agent. I firmly believe it's not going to be an if for the next virus, it's going to be a when. And I want you to feel that what I say is not salesmanship. I have nothing to gain by giving this lecture other than bragging about the success that you're going to experience when you get the benefits of using it. I want you to look at when I give a lecture, whether it's this one or any other one, that you can actually trust me with the information. Are some patients going to get problems with alpha-lipoic? Obviously they are. There's no compound that is symptom-free. But do your own research. Read the articles. Focus on the ones that appeal to you, because I think you're going to be convinced that it makes a difference. When I used to fly that years ago, when you take off the deck of an aircraft carrier as a fighter pilot, you have two responsibilities. Your first one is to take out your target. That's what the government put you there to do. Your second responsibility, just as importantly, is to avoid collateral damage. You don't hurt innocent people. If there's innocent people in the line of fire, you abort the mission and you come back on a new day. The same two principles apply when I take care of my patients. The first principle, since I'm a cancer specialist, is to eliminate the cancer as is best humanly possible. But my second responsibility to that patient is to avoid collateral damage or side effects they don't deserve, and I'm not going to let them experience. Fair enough? I have to tell you that when I drove in tonight, I saw a car in the parking lot with a Colorado license plate. I had no earthly idea that someone would drive all the way from Colorado just to hear my lecture tonight.
Anybody, we might have some questions for you. Okay, if you got some questions, raise your hand. Jerry? You want to get a mic, please? Or Sal, somebody? And by the way, can you send me that PowerPoint presentation? Sure. So we can do it, so I have some information for the bulletin? Okay, thank you. Thank you.
Okay. I'm ready.
Dr. Anderson, I have to thank you because I was one of your patients
Yeah,
since
I remember.
2010 with breast cancer, and because of one of your conferences, I had started on alpha-lipoic acid. However, I didn't know then that I should be doubling my dose. Now I have to go to 600 milligrams.
Yes.
I'm taking 200 BID twice a day.
Yeah, and you've actually covered yourself quite well, but the optimal dose would be 600. Now, if you get any irritation to the stomach, back down again to the 400 milligrams. The value has changed. If you get the R alpha-lipoic acid, that normally comes in 150 milligram capsules, 2 to 3 of those a day are enough. So that's 150, 300, 450, and the reason why that's enough is because our alpha-lipoic acid is 46% better absorbed than the regular alpha-lipoic, so it works out to be essentially the same physiologic dose.
Okay, so you're saying the R would be 400?
Yeah, 450 roughly total daily dose. The regular alpha-lipoic would be 600 milligrams divided dose. The reason I want you to take it in a divided dose is because the half-life or the effectiveness of alpha-lipoic acid is not 24 hours. What you would get is you would get this peak with the potential risk of an upset stomach, and then you get this trough, which means you get no benefit. If you spread the doses out, you can equilibrate and maintain an adequate dose constantly.
So far, I have no problems, and I thank you.
You're very
for that.
welcome. Thank you.
Oh, hi. Yeah, I was wondering about autoimmune diseases like
Yeah.
MG, for example.
Right.
Would that require a prescription for this?
It wouldn't for the alpha-lipoic, but I would want you to talk to your physician about their comfort level. Now, I will warn you ahead of time, very few physicians know anything about alpha-lipoic acid. So before you talk to your doctor about it, please go online and do your own research. Otherwise, what most doctors are going to do, and I probably would have done the same thing, is shut you down as quickly as possible because they know nothing about what you're talking about, and they don't want to appear like an idiot. So the easiest thing to do is just terminate the conversation. So do your research. In fact, even bring some articles in. Most physicians at their own leisure are willing to read the articles. But I've talked to other physicians in lectures like this, And I constantly get calls the next day. Do you realize they use it for this? Do you realize this? So you know that you're educating. But you see, there's no profit motive. There's no pharmaceutical company that's going to pitch this because they're not making any money. It's dirt cheap.
Right. So would the R one be the better?
Well, it would be less risk of a GI upset.
Okay. Okay, thank you.
Yeah.
Right here, stand up, please.
I have two questions. First, I needed to get the website again, and where is this available? Do you have it, or do you get it?
I don't sell it. I give it to my patients free of charge. Here's the reason why. I had a lady that I took care of many years ago who left me her estate. And I was blown away when the attorney called me after she passed. And I said, I cannot take this money, but I will put it into a fund to use it for other patients in the future. And so that has been the basis for financing it. Now, could I take that out of my budget? Yes, I could and I would. But in respect for her, her life is continuing because of what we're doing.
So, do you have to be a patient of yours to get this?
No, you can get it anywhere you want and you don't need a prescription.
Where is that?
Go to the health food store or order it online.
Oh,
Now
okay.
I use, or Walmart.
Walmart has it?
Did you? Okay. And Puritan Pride, now I use Puritan Pride when I order. Again, I have no investment in their stock. But the reason I like Puritan Pride is their quality control is good. When you buy something from them, you're getting what you're paying for. And a lot of supplements, you have no guarantee that you're getting what it says on the bottle. So Puritan Pride is cheap, and they normally give you a special. You buy 2 bottles, they give you 3 for free. Pretty good deal. When you figure out what a bottle costs with Puritan Pride, it's probably about $6 for a bottle, which is pretty reasonable. They come in 100, 200, 300 milligram strength. The most sensible way to do it is buy the 200 milligram and take 1 3 times a day. Of the 200. Now, you could go to 300 twice a day, but again, you're increasing the risk of a GI upset. I would definitely not take 600 milligrams at one time. You're definitely, and the reason why is not only you're going to potentially upset your stomach, but you're going to lose the effectiveness of the medication. You're going to get this peak, and then you're going to get a trough. Now, some people would say, well, look, I'm really interested in this L-glutathione for my liver, so I'll just take that. Well, the problem with L-glutathione is, it costs a lot more, but number 2, it doesn't last nearly as long as the alpha-lipoic. So if you take it within probably 2 hours after you've ingested it, you don't have anything left in your system. Why don't you just let your liver manufacture what it naturally manufactures, which is the L-glutathione? Sure.
I came with one question from a friend.
Okay.
No, I have many. She has Hashimoto's disease.
Okay.
Her initial question was, Dave, find out, I've
It's
been told I shouldn't get the vaccine. And what's your opinion on
Yeah,
that?
I don't know enough about Hashimoto's disease to recommend the vaccine one way or another.
Okay.
I can tell you, if we were talking about the benefits of alpha-lipoic for her underlying disease, you might want to have her go to the website, look up, after you do alpha-lipoic, put in Hashimoto's disease, and you'll find several studies that will come up. It may very well be that with this, she could handle the vaccine. I am not aware of an immune reaction against the virus caused by another medical condition, but that's not my area of expertise.
Okay. Now, after seeing all of this too,
Yeah.
about the time that, a year ago, March, when COVID hit,
Yeah.
she had a relapse with her situation. She was diagnosed about 5 years ago.
I see.
And she's been getting help with integrated medicine,
Yep.
functional medicine. The doctor
And I
she was-
strongly support that.
And supplements.
Yep.
She has a lot of allergic reactions to regular medications.
Yeah.
So she's got a lot on her plate.
Issues, right?
So she had a bit of a relapse around March a year ago, around the time COVID comes in. And so many factors involved, stress, whatever it may be. She really had a bad time.
Yeah.
And she's recovered some, and we had to go to emergency rooms, get her sodium intake
Right.
up, and just kind of a vicious circle. But
Right.
anyway, to get to the point, what you've introduced today, it's almost like a miracle drug.
Yeah.
So many little things. I have a lot of little of this, little of that. I've had replacements. I had a shoulder replacement not too
Right.
long ago. You know, so inflammation.
Yeah.
I'm aware of that. She's been told she has leaky gut.
Right.
She tries this. You know,
And,
so,
and what you're describing in her case makes total sense, because leaky gut is an immune problem.
Yep.
She's just got... Now, the problem with alpha-lipoic is it's too good to be true. And so in our cynical attitude, especially toward medicine, I wouldn't
and
believe
she
this.
would have that same.
So what you need to do is she needs to do her own research.
And she has done a lot.
Okay. Well, then if she hasn't researched ALA,
Yeah.
she needs to get online and spend the next 20 years
When I get
reading
home,
articles.
we're going to be on this.
Yeah.
One final thing that I neglected to mention, she has hypothyroid. So this is where we were working to get that thyroid balanced, and
Yes.
she's got that squared away, and then she's had
Right.
improvement. But she still has, her immune system was just
Yeah,
devastated.
yeah. And the thyroid plays into that whole thing.
absolutely.
So
It
her
does everything.
endocrinologist really does need to play an important
Yes,
part
and-
in this process. I think the difficulty would be with a lot of physicians. I don't know whether you know this, but some of us have egos. And we're a little bit reluctant to admit that we don't know crap about a lot of stuff.
Yeah, she's been through that.
Yeah. Okay.
So, thank you so much.
You're
I
welcome.
appreciate it. Thank you.
Yes, it's medpub.gov. If you go to the National Institute of Health, it'll pop up.
With all due respect, Doctor, why hasn't the FDA, the CDC, Dr. Fauci promoted what you, as a retired pharmacist
Yeah.
of 79
Yeah,
years,
yeah.
when I see something that sounds too good to be true?
It is too good to be true.
Yes.
Yeah. And you will think that this was a setup when I give you my answer, that this was actually staged. I did call Tony Fauci's office, and I talked to 3 separate physicians there. I have talked to the state surgeon general about this specifically and sent them data. And the reply is, thank you very much for your interest. Now, here's my problem, and you'll know this professionally as well as me. If I was at an academic center and had the credibility of the university behind my name, you better believe somebody would be paying attention to what I'm saying. I'm a private practitioner. If you were a private a pharmacist in a pharmacy, who in the heck listens to us? Nobody. Of course it's too good to be true. That's why I request that you do your own research and then decide for yourself, because the publications that I'm asking you to look at weren't done by John Doe. These were done by leading academic institutions from around the world. And when you look at enough of them, you start to think, you know what? Maybe this is great stuff. I've had in my practice of radiation oncology, I've had the same thing happen with malignant melanoma. It's a skin cancer that in 1/3 of patients will spread to other parts of the body. Once it spreads, they're dead. They may not die immediately, but they will all die with metastatic disease. The immunotherapy has helped tremendously, the drug. But those drugs increase survival at 3 years to 40% of patients who have metastatic disease are alive. I developed a new technique for doing radiation therapy 25 years ago on those patients by treating them twice a day instead of once a day at lower doses each time. I got a 100% complete response on every patient I have treated. And 85% of those patients have developed an immune reaction for disease elsewhere that I never treated, but it totally disappears. 80% of my patients are alive at 3 years, compared to 40% with the drugs. And I do it for 2% of the cost of the drugs. Now, I published my data a 1.5 years ago, and it has been disseminated worldwide. And every week, I get calls from doctors in France, Australia, England, Canada, Germany, asking what the dose regimen is that I would give for malignant melanoma that is spread to certain areas of the body. And the doses are all different based upon where it goes. I thought when I published that paper, it was going to be gratification overnight that people would start using it. They're gradually using it. But as I find out, the normal time period for success in medicine is 10 years before it's actually accepted. We could be saving 58,000 lives a year if the technique I developed 25 years ago was used as common treatment for malignant melanoma. So I respect what you're saying. I'm frustrated because what you're saying is the general policy. But you know what? Most things out there are fake. If it is too good to be true, it's not true. That's why I want you to do your own research. Fair enough? Good.
Question.
Yeah.
If you don't have any of the symptoms or diseases mentioned, would you take this as like someone would take it as a daily vitamin?
You bet I would. That's
So-
why I don't demand that my staff takes it, but when you walk into my office, I want to offer you as much protection as possible. And if that compound will decrease the likelihood of you shedding the virus, we know you're going to be exposed to the virus. The question becomes, are you going to disseminate it? And if you're asymptomatic and you're taking this, I'm convinced the likelihood of you shedding has been reduced. What I really wanted was, and I got 2 state senators involved in trying to get a response from the Surgeon General's office about potentially using this. The only way it's going to really work is an academic center does a controlled randomized study. You give half the group the medication, you see what the response is going to be. The other half doesn't get it, and the quantitative difference is going to prove the value of it. We don't really have that much time to sit around and wait, and if I can list all of these other benefits, shoot, throw the benefit for the COVID virus in on top of all of that.
One more here.
Yep.
You're saying anybody can just take this over the counter. You don't have to get
You
a
can buy it
prescription
over
or
the
anything.
counter. Whether you
Okay.
should take it or not depends on your
Well,
research.
well, yeah. I know the disclaimer. I'm just saying, wouldn't you have to have a complete evaluation of the current medications you're taking and your medical history prior to, experimenting?
I think that would be reasonable. But that's also another reason for you to go online and look up that as far as contraindications. Because this stimulates a natural response, not an artificial response. So I wouldn't look at it as an aspirin, but I know that very few people go through a detailed history before they start taking a baby aspirin, unless, of course, they're already on blood thinners, and then that needs to be monitored very closely by their physician. There are many non-prescription entities out there that people do take. In no way am I endorsing this. What I want to do is to make you aware of it and let you do your own research. Having said that, any benefit you get, I will take full credit for.
Do you have a website? Because I have a friend that has cancer and now it's affecting his liver.
I don't have a specific website. rboi.com is my company, and we do have several articles in there. rboi.com. Robert Boisneau Oncology Institute.
I just handed it to him.
Yeah. Thank you very much for having me.
Dr. Anderson, thank you again. Like I said, I think this is the 3rd or 4th presentation he's done while I've been president. He's done some before that. And they're always really entertaining, and they're always very forthright and honest as far as I'm concerned. So thank you, and I can't wait till we have you again. There will be donuts. Yeah, there definitely will be donuts. If it's just for you, I definitely will have donuts. Thank you guys for coming. We'll see you next month, hopefully, on our lightning presentation.